Hello. So I am Dr. Varun Mittal, Senior Consultant Urology and Kidney Transplant, Fortis Hospital, Gurgaon. Today I am going to give you basic information about hematuria. What is hematuria? Hematuria is presence of blood in urine. It can be of two types, gross and microscopic. Gross means you are able to see the discoloration of urine. It can be pink, red or brown. Microscopic means otherwise urine is clear, but you are able to see the blood under the microscope. Both of these situations are alarming and we have to find out the cause. Cause include two types like serious and non-serious. Coming to non-serious, most common is infection, that is urine infection. It can be kidney, bladder or prostate infection, which is more common in older males, diabetic females. Other common is stones, like it can be kidney stone, bladder stone, which are more common in younger patients, male patients. Other common causes include recent vigorous exercise, sexual activity after a prolonged abstinence, and menstruation in females, which can be misleading. It can be just blood related to menses, otherwise there is no problem. Coming to serious cause, whenever you find blood in urine, it can be an alarming sign of or first sign of cancer. It can be kidney cancer and bladder cancer, which are most common, and third one is prostate cancer. Other serious cause is presence of cyst in both the kidney, which is called as polycystic kidney disease. And some rare causes which are also serious include bleeding disorder like hemophilia, blood disorder like sickle cell anemia, thalassemia. So after discussing the cause, I will come to the diagnosis. So whenever you have blood in urine, you have to visit your doctor, which the doctor will basically ask you the history. Is there any history of infection like fever? Is there any history of stones in the past or surgery in the past? So after taking the history and doing a brief examination, we will get the basic test like urine test to confirm the presence of blood in urine. The urine test will also indicate is there any recent infection. Will also provide information regarding protein in urine, which can be more common in medical cause of hematuria. Then other tests includes complete blood count, which will give us three information like hemoglobin, which we can have information of anemia or bleeding disorder, platelet count, and total leukocyte count, which is just a sign of increase in total leukocyte is a sign of infection. The other test which is very important is kidney function test, which includes serum creatinine, most important, which will help us to taper the management or getting the further tests done. So most easily available, cheap and community dependent is ultrasound. Ultrasound gives us basic idea, gives us the presence of stone or tumor in the kidney, cyst in the kidney, any recent infection of the bladder, kidney infection. So gives us a gross idea of what is going on inside your body, which is leading to blood in urine. So if the ultrasound and these tests are not much diagnostic, then we have to move on to the special test, which is called as CT scan. CT scan gives a one-stop solution, one-stop diagnostic solution, which will give us the whole idea about the stone, cyst in the kidney, any tumor in the kidney, bladder or the prostate. Some cases where the CT scan is contraindicated, where the patient is not fit to undergo CT scan, like having contrast allergy, which we use in the CT scan, or patients having kidney failure, where we cannot use the contrast. So then in these cases, we tend to do MRI. MRI is a second line investigation, which can be done in these cases. So after getting all these tests, the diagnosis is made and accordingly the treatment plan is provided. So idea of giving this short information is that the take home message is, if you find blood in urine, it can be first sign of cancer. Most common is kidney cancer and bladder cancer. And so I will advise you to visit a nearby urologist to find out the test. Thank you.